global warming is causing catastrophic damage to planet Earth. Now, the rising temperatures and also the many consequences it will lead to will be one of the biggest challenges of this century. But the trouble is, despite the research that is already being done on climate change, we still don't completely understand as to what extent climate change will impact our lives. Now, the latest research that has been done, it is being predicted that a rise in the average temperature of planet Earth may lead to increased instances of kidney stones amongst people. Kidney stones happen to be a medical condition where a small hard deposit forms in the kidneys. These stones often cause severe discomfort. It's a medical condition often exacerbated by heat and dehydration. Now, over the last 20 years, kidney stones have been on the rise, especially amongst women and children across the world. And now it looks like climate change is also making it even worse. Previous studies had indicated that high temperatures raise the risk of kidney stones. There's also considerable evidence that supports this claim. Now, kidney stones are known to be more prevalent, especially in the hotter summer months. And researchers have used essentially two climate scenarios to try and estimate the burden of heat and humidity in South Carolina, a state in southeastern United States, which has reported a higher than average incidence rate of kidney stones. So the obvious question is, how does rising temperature actually result in more instances of kidney stones? Now, the researchers behind this study have noted a few possible means. Essentially, that hotter temperature means more water is evaporated. And when we take the human body into account, this means that urine becomes much more concentrated, especially as the water escapes from the body in the form of sweat. Now, the concentrated urine could also be an ideal environment for minerals like calcium, oxalate, phosphates and uric acid to get crystallized, thereby resulting in increased instances of kidney stones. However, the exact process still remains unclear. It's a question of diet and lifestyle changes that usually contributes to a rise in this condition. But prior research has shown that high temperatures increase the risk of kidney stones, and the number of people who are now seeking medical help for kidney stones has escalated following the very hot days when the risk of dehydration has also increased. All right, now to give us more insights in terms of how climate change is actually resulting in an increased instance of climate stones, we're joined in by Dr. Barry Gorlitsky, who's joining us live from South Carolina. He's also a nephrologist. Now, Doctor, this is something which not a lot of people would have expected. We all know that climate change is going to increase temperatures on planet Earth. But how is this related to an increased instance of kidney stones?
Yeah, so this study was, fascinating. It took place in my home state here in South Carolina in USA. And, what they looked at is they said, look, South Carolina already has a high incidence and prevalence of kidney stones because it is in a warmer climate. And what they found is kidney stones tend to occur more frequently in warmer climates. So in the US, going from north to south, we see increased incidence of kidney stones, and going from west to east. And so we're in what's called the kidney stone belt here. Mm-hmm. They think a lot of that has to do with temperature. Probably other risk factors like being overweight or having diabetes may also contribute. Diet probably contributes as well. And so what that study showed is that if we look at global warming and the increases in temperature over time, and they showed kind of two scenarios to say, hey, if we really don't do anything about global warming and just let it continue to increase at the rate it's going, we'll see tremendous numbers of increases in kidney stones, which would burden our healthcare system here in South Carolina by about $100 million. If we temper some of that back and decrease the greenhouse gases to a lesser degree, we still see a temperature rise, but it wouldn't be quite as much. And they thought about $57 million attributable just to kidney stone formation just in South Carolina, USA.
It's always baffling as to how these things are related. Climate change and increase in global temperatures, this could potentially result in an increased instance of, kidney stones, a medical condition that is now being reported increasingly in areas that have warmed up due to climate change. Now, for people who are watching this broadcast, is there something that we can do, a change in our lifestyles perhaps, to try and ensure
Yes,
that we do not end up with this condition?
absolutely. So, the first thing to always do to try to prevent kidney stones is, if you're able, is to just drink more water. What happens is you alluded to it earlier, as you become dehydrated, decrease your water intake or sweat that fluid out, the urine becomes more concentrated. And the concentration is what leads to precipitation of things like calcium and oxalate and phosphates that will actually form the stones. So the first thing to do for anybody with a kidney stone condition is to just drink more water. That will help flush the kidney stones out, help prevent that precipitation from occurring. Other things you could do is a low salt diet. That's really important, as well as weight loss, exercise, and just healthy eating in general. Lots of fruits and vegetables.
Absolutely indeed. Thank you very much indeed, Dr. Barry Gorlitsky, for joining us from South Carolina and getting us all those insights in this.
You're welcome. Thank you.
Thank you. WION is now available in your country. Download the app now and get all the news on the move.